I put together the table of electrical stimulation to try and call out different abbreviations that are used in different resources, and kind of tried to call out the types of currents involved in those forms of electrical stimulation, really what the goal is. So try to become comfortable with the different ways that electrical stimulation is referred to in the clinic and in various texts. At the top of the table, the first two, you should notice that electrical muscle stimulation, EMS, and electrical stimulation for tissue repair are both direct current applications. So immediately, clinically, you should be thinking, when I'm using electrical stimulation, electrical muscle stimulation, and I'm using a direct current, I'm really working with a patient that has denervated muscle. So you have a muscle that is going to lose its size and shape and nutrition unless it gets stimulated with a direct current. And that is different than neuromuscular electrical stimulation. That is a muscle that is innervated, but we're working to restore function. So an example would be a patient who has had some form of paralysis associated with stroke or other neurological condition. They have a central nervous system disease or deficit that has resulted in a peripheral nerve weakness and therefore muscle weakness, but the nerve is still healthy and active, and the neuromuscular stimulation is used to help re-educate the muscle. Post-operatively, you may be able to also do some re-education, particularly if there's disuse atrophy due to pain. So that there's some terminology that's specific to whether or not a muscle has a nerve or is denervated. And then when you're looking at functional electrical stimulation, that's referring specifically to folks who are in the spinal cord injury population, where you're actually using, or post-amputation perhaps, where you're using electrical stimulation to sequence movements. And then we have, of course, electrical stimulation for pain reduction, and you can see that alternating current for TENS and interferential current in our commercial units are also alternating current, where polarity doesn't matter. The Estim parameters, we'll spend some time talking about this in lab, and when we're selecting a frequency, sometimes it can feel like a big black box, like what do these numbers mean and why does it matter? So when you are taking a look at some factors regarding patient comfort and ability to receive a therapeutic stimulus, you can see how frequency is affects impedance. You can see how frequency affects comfort, how frequency is classified. In older TENS units, frequency is something that we can manually manipulate quite a bit, and in newer units, frequency can come pre-programmed. So it's still important for PTA to understand how frequency impacts patient comfort and tissue effects, particularly in the ability for the current to overcome resistance in the tissues. Our commercial units come pre-programmed with frequency when we're looking at NMES and high volt galvanic stimulation. And those are our medium frequency units. I believe both classes have the Richmar unit. And you will be able to set the duty cycle on those units, and you will be able to set the ramp time on those units. So again, a PTA should be able to understand the significance for patient tolerance, comfort, and clinical effects when looking at intentionally selecting a duty cycle or ramp time. And your text, again, is a great resource to help reinforce your understanding of the clinical significance of these. I've included a picture to kind of help visualize what ramping looks like as it relates to duty cycle. And then again, there's a table to talk about the differences between eliciting a muscle contraction when your brain sends the message and when a machine sends the message. And this is just a good thing to review because patients often have questions and you want to be able to summarize it for them in simple terms so the reason you're recommending this treatment is credible and well understood by yourself as well as the patient.